Let's talk about joints today. As complex as the anatomy is, one of the principal goals or objectives is to try to help students getting some kind of decent, easy to understand, easygoing, and relatively simple classification of all structures that the human body can offer. Of course, as part of anatomy, Syndesmology and Arthrology, science that is concerned about how bones are connected together and what kind of motion will be allowed at certain joints, also requires, for a start, a classification that will understand at least the basic composition of joints, so we can go a little bit further on. In essence, two different types of classification exist. One is to use the structural classification of a joint, which in essence explains what kind of material is used in order to enable connection that exists between two bones. And the other one is functional. And of course, by function, we consider what type of movement and what range of movement a joint can perform. So let's talk first about the structural classification of joints. Perhaps the skull is the best place to start if we're to disclose more details about the structural classification of joints. On the basis of a structure, which is material being used to connect two bones, we have three different joint categories. We have joints where fibrous connective tissue is used, so therefore we call them fibrous joints. Otherwise, we can have a piece of cartilage being inserted between two parts of the same bone or between two different bones, therefore we're talking about the cartilaginous joints. And thirdly, what appears to be probably the most important group of joints within a human body are those ones where tiny film of synovial fluid is encapsulated between two bones, and usually that kind of joint ensures that joint would have significant degree of motion. Those joints are therefore called synovial joints. So let's take first at three subcategories of fibrous type of joint. Let's start with the bones of the skull, and I'll try to zoom in to temple in order to show you what properly formed suture would look like. So here we are. We have this beautiful connection that exists between parietal and the occipital bone, and this type of fibrous joint is what we call the suture. In this case, the skull obviously belonged to an individual where a fibrous tissue has significantly regressed, and therefore we only have some traces that are seen in between those irregular parts of the suture participated by parietal and the occipital bone. I used the Play-Doh and placed it on two different spots on the skull. They are going to identify position where originally fontanelles were found. So this is the greater fontanelle, pretty much diamond squared area. Approximate size is about 2 by 2 centimeters in a newborn, and it is located between two halves of the frontal bone and left and right sided parietal bones. So this is a good example where fibrous connective tissue has been placed between multiple bones of the skull, and gradually, over the course of the first year of a life, the size of a fontanelle is going to gradually reduce until it completely closes and disappears. In English-speaking countries, it is usually referred to as the soft spot of the skull. This is for us greater fontanelle or fontanelle major, so its closure is around first birthday. Also, there is another fontanelle, which we see on the back of the skull, a little bit smaller, shaped like a triangle, and positioned between left and right-sided parietal bones and occipital bone. Closure of this fontanelle is also expected within the first year of life, but somewhat earlier, which is around 6 months of life. So fibrous tissue that was originally filling the gap between occipital bone, parietal right-sided and left-sided bone is going to be replaced by bone tissue. So when that happens, we'll just peel off the Play-Doh, and we can see here just a tiny bit of a green Play-Doh which has been left within the suture. That would be equivalent of how much fibrous connective tissue is left here. The second subtype of fibrous joint is what is called the gomphosis. Gomphosis is best illustrated by using either upper or lower jaw, and illustrating insertion of teeth within. We'll take a look and try to move this molar tooth. Although it looks quite loose, it is not possible to pull it out of its socket. What essentially exists is a little bit of a fibrous connective tissue which is deposited around the root of a tooth and, of course, inside these individual sockets that are called alveoli. Bonding is quite firm, and of course we consider this to be a joint with a limited type of movement in order to just explain that our teeth will be able to detect and respond when, while chewing, the tooth detects a little bit too significant pressure being placed on its crown, so we would have exact idea as how much power we need to apply in order to chew the food properly, but without damaging our own teeth. So that is fibrous type of joint, which is called the gomphosis. Third type of fibrous joint within a human body, and perhaps what I can say the most obvious one, is type of joint which is typically referred to as the syndesmosis. Syndesmosis is best illustrated by using two bones of the forearm, the ulna and the radius, and illustrating or assuming that one already acquired significant knowledge about the osteology, pointing out to interosseous border of both radius and ulna, to which the interosseous membrane will be attached. Interosseous membrane is not going to ossify. It is going to be quite thin, semi-transparent, and very pliable. So membrane is going to have major role to practically keep these two bones together, parallel to each other, but it would not interfere with the movement when the radius starts spinning around ulna, performing supination and a pronation movement. I tried to put a little bit of a Play-Doh in between these two bones, but it doesn't look that good, so I believe this is also a good explanation of what syndesmosis is. We would have a similar example of syndesmosis between two bones of the leg, the tibia and the fibula, but the composition of joints between tibia and fibula does not really require so much movement, so for that reason I decided to use bones of the forearm as a little bit better example.